Well, when we brought you the COVID-19 numbers of the day, we did mention that it also happens to be World Cancer Day. And in that respect, we'll be bringing you the latest numbers as given to us by the Ministry of Health with regard to cancer. Now, the Ministry of Health has identified 5 cancers as being responsible for over half of the cancers reported in the country annually. And the number of cases we get annually is 42,000 on average, and half of that is 21,000. Now, the 5 cancers this leading is breast cancer, followed by cervical cancer, prostate, esophageal, as well as colorectal cancer. Now, over the last 5 years, the World Health Organization estimates that 82,620 people have been diagnosed with cancer, 66% of whom are women. I did mention that women are disproportionately affected, given that the 2 leading cancers are breast and cervical cancer. Now, the biggest challenge identified when it comes to cancer treatment is the failure to detect it early, with 60% of breast cancer cases, for instance, diagnosed in the later stages, that being stage 3 and 4, and that is when the cancer has spread to surrounding tissue and at least one other body organ. It's therefore more difficult to treat. Now, only 16% of Kenyan women between the reproductive ages of 15 and 49 have undergone cervical cancer screening, with a fewer, that is 10%, having gone through a clinical breast exam. Now, these figures are hardly surprising when you take into consideration that a cancer diagnostic test at a public facility will set you back an average of 44,000 shillings and up to 132,000 shillings in a private facility. And even if your cancer is diagnosed early, it will cost you between 147,000 and 1.2 million shillings in a private hospital for inpatient treatment of breast cancer. And when I say early, I'm making reference to the first 2 stages. Now, it's no wonder then that many families are rendered bankrupt by cases of cancer.